Dr. Peter Chin Hong is an infectious disease specialist at the University of California, San Francisco. I spoke to him earlier. He talks about the significance of this milestone.
It's not only the absolute numbers of lives lost, but the potential that we could have saved many of these lives by the tools that we had from 1 year ago to now.
Peter, let me kind of get a breakdown on 2021. It's a good time to reflect on what global leaders and scientists did right and wrong over the last year. Why don't we start with right? What were some of the silver linings that you saw in this last year?
So in the last year, probably the biggest silver lining is the rapid development and rollout of the vaccines. I mean, I think that is, the 1 year following the vaccine rollout, that is huge. That is like as important as sending a man to the moon in my estimation, because it led to hundreds of thousands of lives being saved, even with focus also on the lives that could have also been saved in addition. It nevertheless led to that remarkable achievement. It led to us going about lives a little bit more normal than early in the pandemic. And it led to kids going back to school to some regard. Of course, there were disruptions, but nevertheless, that continues to happen. And it led to people reuniting, hugging each other, seeing friends, seeing family, seeing parents and grandparents and uncles and aunts when they didn't have that before. And I think, again, we focus so razor sharp on vaccines, and I think a lot of people have forgot about the other interventions that we need to use, and they've become so political, like wearing a mask means that you don't want to support personal freedom. And that as a healthcare intervention makes so little sense to me, and in fact is demoralizing. I think other silver linings are really the other therapeutic developments that we've made, oral agents for COVID, and figuring out how best to treat people once they're in a hospital. And, even though I've decried not enough use of testing, rapid at-home testing has also been a boon, although we need to see governments pay for this more often, like they do in some countries like the UK and South Korea.
Some of the things that we're also seeing emerge, variants, Delta, of course, of great concern as much of the year went by, Omicron coming up at the end of the year. Talk to us about 2022 and your concerns about these continued variants, because you're going to continue to see mutations. What are your fears moving into the next year, and what are positive signs you see moving into 2022?
I think what we will continue to see is more of these variants being created. But as we roll out vaccines more and more, and I do hope that more and more people will get them, what we will realize over time is that really is the most powerful way to prevent hospitalizations and deaths. I think we have to separate an infection surge from a surge in hospitals, and maybe at the end of the day, having a mild infection, if that's the way that SARS-CoV-2 is going to evolve, together with vaccines, would lead to hybrid immunity that will get us out. But I don't see the world being vaccinated anytime soon, and it will take probably a couple more years for most of the world to get vaccines.
Peter Chin Hong there.